My name is Humera Hussan. I'm a nurse practitioner in neurology. I have been back and forth between Minneapolis and Dallas over the last few years. I started my education in Minneapolis at the University of St. Catherine, and then I moved to Dallas for my master's. I've been in neurology for the last 3 to 4 years. It's something that I really enjoy. My special interest within headaches is how headaches impact women, specifically looking at menstrual migraines and how those can be handled in, different ways, not just with pharmaceuticals, but also with supplements and homeopathic treatment. I think that one of the most important things is that patients are at the center of all the care that we provide, and really to find out what types of treatment align with the patient's values and beliefs and their lifestyle and what they feel comfortable managing. As providers, we can always give suggestions, but ultimately it's up to the patients to follow through and to make that part of their lifestyle. And that can only work if patients agree on the treatment that we're offering. So I think it's really important to not only offer prescription medication options, but also other supplements and other modes of therapies, physical therapy, rehab therapy, just because everyone has kind of their own personal preference for how they want to be treated and the treatments that they're interested in. Patient-first care is critical because, again, while we can support the patient as best as we can, at the end of the day, it's the patient following through on that care plan. And if our care is focused on the patient and what they want, they're a lot more likely to follow through. And if it's something that they feel is dictated on them, or if they feel they're not being heard, so really listening to each patient and finding out what they're comfortable with and how they want their care managed, I think is really critical to good patient care. My mother has chronic migraine and more recently trigeminal neuralgia. I've seen firsthand her experience navigating through the healthcare system with different providers to kind of get the treatment that she's really liked. And after many, many years, she's kind of found a treatment regimen that she likes that is a combination of pharmaceutical medicines, Chinese oils, and herbs. So I think it's really important to know that different things work for different patients, and sometimes more than one mode of therapy is also needed. I provide support to my mom, initially going through the different visits with her and helping her talk to the providers and discuss and navigate other treatments, but also to listen to her on a regular basis. With chronic health conditions, people can often feel that they're not heard because they've seen so many providers and people and discussed their problems with them. So I think kind of treating each day as a new day and really focusing on the symptoms that she's having and other modes of possible benefit. She had tried medications for a while, and then kind of more recently we had looked up and found more information on a Chinese oil and had her try that, and reminding her to try heat and ice and other therapies that could work for her as well. And honestly, a lot of times it's just being there to listen. I think patient advocacy is very important because, number one, the medical system is very complex. So for a lot of people, even just navigating through making an appointment, seeing the right provider, where to go from there can be challenging. On top of that, a lot of times there's communication barriers. A lot of times we as providers don't talk in a way that patients can really truly understand what's going on. I think it's really important for us to help the patient be their own advocate and for patients to really fight for being an advocate for themselves, because at the end of the day, good patient care relies on us being advocates for the patient, them being advocates for themselves, and making sure that everyone is being heard and treated fairly.